Hello, everybody, and welcome to episode 33 of the Pet Behaviour Chat. So we've got a pretty juicy episode today because we're going to be talking all about separation anxiety, or should I say separation related behaviours, and we're going to get on to the definitions in a second. So there's a lot to talk about. It's a big topic. It's a very commonly presented behavioral challenge. It's a behavior problem. And I just really want to kind of cover the basics in this episode. And there are going to definitely be more episodes on this topic that are going to delve into sort of the more particular areas to do with separation related behaviors. So let's get started, and let's start by what I just said, which is talking about definitions and what we should actually be calling this, because it's kind of classically, traditionally, colloquially known as separation anxiety. That's what we talk about, which is basically a behavior or a set of behaviors that particularly dogs might perform when they're separated from their main caregivers. However, they can perform behaviors due to separation from their caregivers for a number of different reasons. And those reasons need not necessarily be anxiety related. So it's probably better to talk about separation related behaviors, which is a little bit more neutral and really just talks about certain behaviors, usually unwanted behaviors or distressing behaviors that a dog might perform when their main caregiver is not with them, and most classically when their main caregiver is not at home and the dog's left home alone. But we need to understand why they're performing these behaviors. And in many cases, it absolutely is because of anxiety or distress or panic due to the separation from their caregivers. But there can be a whole host of other reasons for that. And I'm just going to mention a few to you. I'm sure there are a million more, but just a few other sort of separation related behaviors that I've seen that have not necessarily been related to anxiety can be the following. So we can have the dog performing behaviors due to confinement rather than separation. So let's say, for example, the dog is crated when the owner leaves, and the dog is then displaying escape behaviors from the crate. And that might be due to confinement-related distress rather than actual separation from the caregiver. So that's something really important to differentiate. Secondly, we could have behaviors such as destruction or let's say rambunctious play behaviors, maybe a bit of counter surfing, also when the dog is left home alone. And that need not be because they're feeling anxious. It might just be because the opportunity presents itself that when mum and dad are away, I can all of a sudden do all these behaviors that I'm not able to do when they're at home because they're watching me and they're perhaps stopping me from doing those behaviors. So it's a little bit of, whilst the cat is away, the mouse will play sort of thing. And we can see a lot of, especially destruction related behaviors due to excessive play, those seeking behaviors. Maybe that's boredom related. The dogs are just kind of looking for something to do whilst they're home alone. So that's something else to think about. Is it really anxiety driven or is it driven by a different motivation? And then the other thing that we sometimes see is that dogs get anxious when they're home alone, but it's not necessarily due to the separation from the caregiver or due to being left home alone. It's because something else in the environment might scare them. So maybe there's a loud noise, maybe there's the garbage truck goes by outside or the fire alarm goes off in the building. And it's that causes the anxiety or the panic behavior. And because there's nobody there to provide safety and security and to help sort of calm them down, that can escalate into a severe anxiety, distress, or panic behavior. But it's not the separation from the caregiver that's initiated that, it's something else in the environment. So as I'm talking through this, you can start to see that there are a lot of different causes for dogs performing unwanted behaviors when they're home alone or when they're separated from their caregivers. And it's really important that we delve into this, because if we just presume that it's kind of the classic separation anxiety presentation, we could really be missing some big important clues, and then our treatment plans aren't going to work, right? If we're not addressing the right cause, or if we're not seeing the big picture, if we're not understanding what other environmental cues there might be, if we're not understanding what that emotional motivation is for the dog to be performing the behaviors, and we just kind of go ahead and go through our separation anxiety treatment plan, if you like, then in some cases we're going to miss a trick, and we're going to miss sometimes perhaps a very simple treatment option for that patient. So that's a little bit about kind of classification, terminology, how we define things. So I do feel that separation related behaviors is probably a more appropriate term until we know for sure what that underlying motivation is, behavioral motivation is. I've also heard it called separation anxiety syndrome. There are a couple of different ways of, I guess, classifying it. And obviously, as we know, one of the biggest challenges in veterinary behavior medicine in general is that we don't have a unified classification, is we don't have a common terminology that is standardized, worldwide throughout the globe on what we actually call things. So somebody in Australia might call this set of behaviors something totally different to somebody in the US, to somebody in Europe. So that's just a little bit about kind of what we call things, and why it's really important to be very clear about what actually the behaviors are and what's motivating those behaviors. So sometimes taking a more descriptive approach can be really, really helpful. Okay, so the next piece I'm going to talk about is what actually causes separation anxiety. And here I am talking about kind of the classical, distress or panic behavior due to separation from a caregiver. And so the question is, well, what causes this? What's the etiology? Why do dogs do this? And the answer here is kind of a little bit complex in that we don't know for sure, but it's possibly going to be a combination of things. And when we think about what causes behavior, we go back to our classical approach, our three-pronged approach of it's usually either genetics or the environment or learning, or a combination of those things. So those are the three things that we want to look for when we want to look for what causes unwanted behaviors or behavior problems, behavioral disorders. And I just want to chat through those kind of three areas as to what might be happening here in the case of separation anxiety. So the first one is genetics, and I find this super interesting. So we do know that there are some genes or some genetic components for anxiety behaviors in general. But I think with separation anxiety, it probably goes a little bit further than that. And we're actually talking about kind of how we as humans have influenced the genome and genetic makeup over many, many, many years, many hundreds of thousands of years during the process of domestication. So domestication is a process whereby we actually change the gene qualities, or the genome, if you like, of a species in order for them to go from their wild form to their domesticated form. And if you think about certainly more recently, as individual breeds have kind of materialized in the last sort of few hundred years, I would say, we have been breeding more and more selectively for companionship. We've been breeding for dogs wanting to be, very closely associated and very closely attached to us. We've been breeding them for those dogs, for characteristics that allow them to live in our homes, in our domestic environments. And we've also bred them for these kind of juvenile features that we find very, very attractive. So we call that neoteny, where we're selecting, we're purposely selecting for physical and behavioral traits that are very kind of juvenile, that are very sort of baby-like, if you like. That's why, we get dogs playing through into adulthood. So wolves, for example, would stop playing at a certain age, usually around 4, 5, 6 months. But we know that our domestic dogs play throughout their lives, and play is a very, juvenile characteristic. It's a behavior usually performed by young animals, baby animals, as they're learning to sort of navigate their world and they're practicing behaviors for adult life. But we've very much selected for these juvenile features, and we've selected for that companionship that I spoke about. And when we talk about separation anxiety, that might be a problem because we've potentially selected so much for this companionship that dogs genetically might find it very difficult to be separated from their caregivers. So I think there are definitely a number of genetic factors that play into this, whether it's kind of specific genes that we know are altered in fearful or anxious dogs, or whether it's this bigger picture of domestication over the years that have really favored these companionship traits and these juvenile traits. So that's the first thing. The second thing that we want to think about is learning. And I think especially for separation anxiety, we want to think about early life learning. And we have in dogs this very, very critical socialization period, which starts at around 3 weeks of age and goes up to about 12 weeks of age, perhaps a little bit longer, maybe up to 16 weeks of age in some individuals and in some breeds. And this early kind of socialization period is really, really important for learning about future behaviors, or it's very predictive for future behaviors. So in that socialization period, we want to be able to teach puppies a whole load of things in a very, very gentle way. But one of those things is that we want to teach them independence. We want them to learn that being on their own is fine, that they absolutely can be on their own without that being a big problem. And we want to make sure, that they learn that in a really positively reinforced way, so that actually, being alone equals great things happening. And if we think about the window of this socialization period, I mentioned it starts already at 3 weeks of age. Well, at that period, during that period of time, most puppies are still with breeders, or they're still, with their mum and their siblings. And they usually only kind of come to their new homes between 8, 10, 12 weeks of age, something like that, which then leaves a relatively short window for caregivers to start teaching some of these kind of independence behaviors. So we really need to think about that, right? We need to think about how we can teach dogs that being independent and being on their own is great. And I think, when we talk about COVID, that's perhaps something that maybe was difficult to achieve in those COVID puppies, because there wasn't really a lot of opportunity to teach them independence. And I want to be really clear, this doesn't have to be like, really sort of leaving them on their own and going out and kind of, flooding them almost with this kind of being on their own. It can be as simple as just leaving them in a different room with a Kong or a activity puzzle, a food puzzle toy, a licky mat or a snuffle mat for really short periods. You can separate them maybe with a baby gate. Start off with kind of, separating them for 5 minutes, then increase that to 10 minutes, and so on and so forth, and pair that independence and that kind of separation from the caregiver with something really positive. So learning is a really, really important piece here. And, we need to be actively teaching that to our puppies in a very, very gentle way to make sure that in the future they can cope with being left alone. So that's the second piece. So we've gone over genetics, we've gone over learning, and then the final piece is the environment. And of course, that can be multifactorial, and that's quite a big piece. But we want to make sure that when we do leave our puppies alone, we provide them with an environment that's really conducive to them feeling comfortable alone. So we want to make sure they have, safe resting places. They can have that kind of secure haven or safe haven that they can be when they're home alone. That they have kind of comforting toys around them, things that they like, that they have free access to water, that they've been fed, that they've been able to use the toilet before, we leave them alone. Sometimes something as simple as, distress caused by needing the toilet, especially, when they're young, and not being able to have that need met, that can be distressing, and that can contribute to feelings of unease when being left alone. So we want to make sure the environment is really conducive to them being calm and feeling safe and secure when left home alone. You might want to consider using pheromones. You might want to consider using calming music. There's so much that can be done. And we want to be, really mindful of those other environmental factors that might cause them to feel scared that I mentioned in the beginning. Environmental noises, whether they're noises coming from neighboring apartments or kids or dogs barking or the garbage truck or fire alarms, whatever it might be. So the environment needs to be conducive to a dog being able to feel safe, secure, calm, happy, occupied, with having all their needs met when they're being left home alone. And just quickly to circle back, there's actually something I forgot to mention when I was speaking about, how do we, the different types of things that can mask, if you like, a separation behaviors. So, whether it's counter surfing or being fearful of an environmental stimulus. How do we know that? Well, your absolute best friend in these situations are going to be video cameras. And that's a little bit also when we want to make sure that we're providing an appropriate environment. It's a really great idea to have a number of video cameras set up throughout the home that you can either actively watch through an app on your phone, or that you can play back to actually understand, what does my dog do when they're left home alone? Do they show any kind of separation related behaviors? Is there a trigger in the environment? Is there something that they're finding uncomfortable? Do they need to go to the toilet? Is their water bowl empty? So getting that information when they're home alone is really, really valuable, and video cameras are your best friend. So, separation related behaviors and their treatment have really come on in leaps and bounds because we've been able to access this information that we need, and that we're actually able to understand what's causing these behaviors so that we can address them properly. So video cameras are your absolute best friend. And I would encourage anyone, whether you've got a puppy or whether you've got an adult dog, to have some video cameras set up that you can watch what they're doing when they are home alone. Okay, so that's a little bit talking about causes of separation-related behaviors, specifically separation anxiety in this case. And now I want to move on to what are the classical signs of separation anxiety. And again, I'm going to focus here on that kind of classic anxiety presentation, because, essentially, we could have all kinds of behaviors when dogs are left home alone for a number of different motivations. There could be play, there could be counter surfing, there could be, getting into things because they're bored. That's not what I'm talking about here. What I'd like to talk about now is those classic signs, like what do dogs do? What are our clinical signs of true separation anxiety, separation distress? And we probably have three that are very, very classic. And that is number one, vocalization. So that can be barking, whining, howling when left home alone. The second one would be elimination. So urination and defecation in the home when left home alone. And the third one would be destruction. So destruction of items. And that can be as little as, maybe ripping the stuffing out of a bed, right up to some very severe kind of destruction behaviors that can be performed in an attempt to be reunited with the caregiver. So I've seen dogs try to dig through doors. They've, dug under fences in the garden to escape the garden and look for their caregiver. I've seen, dogs try to go through windows. So, those are, I would say, kind of the extreme ends of destructive behaviors. But even things like, I had one case where the dog would just kind of push objects off the table. They would just kind of go to the table and just with their paws, like push, I don't know, a lamp or a candlestick or something like that off the table. So sometimes that they can be quite subtle. And So those are your three classic, that's what we talk about when we talk about kind of the classic behaviors of separation anxiety. However, there are a whole host more. And some of them are easy to know about, right? So if your dog is barking, whining, vocalizing, chances are that maybe your neighbors might say something to you. Obviously, if they're eliminating, you're going to come home and you're going to know that they've eliminated. The same with destruction. You're going to come home and you're going to see the items that have been destroyed. But there are other behaviors that you wouldn't necessarily know that the dog's doing unless you've got a video camera set up. So that can be pacing and patrolling, patrolling the borders. That can be lying by the front door without moving and just fixating on that front door until the caregiver comes home. That can be trembling, that can be salivating, that can be withdrawing into themselves and just kind of going into this almost catatonic state. So those are behaviors that you wouldn't necessarily know about unless you saw them on a video camera. So again, the importance of knowing actually what they're doing. And sometimes they might not display those classic behaviors and you might not know that there's a problem until you've actually seen it on a video camera. And it can sometimes be pretty eye-opening, and sometimes quite sad to see what they're actually doing when they're left home alone. So again, a big shout out to video cameras and to recording some of these behaviors. And then, of course, we've got the whole spectrum of intensity of those behaviors. It might be mild. We might have, a few little whines in the beginning as the caregiver leaves that might last for this kind of classic period of around 20 minutes. And then the dog maybe finds something else to do or the behaviors kind of reduce a little bit. But they can go right up to extremely severe manifestations of these behaviors. I mean, I've seen some pretty intense behaviors, and some of them can be self-injurious, right? So dogs trying to dig out of doors to the point where they make their nails bleed, or dogs trying to bite out of crates to the point where they fracture teeth. Again, the dog's trying to jump through windows or get out of windows, dig out of gardens. And then also the extent of damage that they can do to homes, that extent of destructive behavior. I've seen a couple of really extreme videos where, caregivers have come home and it looks like they've been burgled because the dog has just literally thrown over pot plants, pulled things out of cupboards, thrown things off tables, overturned pieces of furniture. It can be really, really severe. So I would probably say, we need to be mindful of the intensity, the severity of the behaviors from mild through to very, very extreme like that. And then also we need to be mindful of the range of behaviors that dogs can do. Yes, we've got our three classics and, in most cases, at least one of those three classics, if not all of them, are present, but we might have other behaviors as well that are not as easy to know about unless you maybe see them on a video camera. So that's a little bit about presentation and, what are the signs, what would dogs normally do in these situations. And of course, if you imagine you're a caregiver living with a dog that is so distressed when left home alone, that starts to become very, very debilitating for the caregivers themselves. Gets to the point where they can't leave the dogs home alone. They either become very, very limited in what they can do themselves, how much they can leave the home, or they have to find, dog sitters, friends, take dogs to daycare, make sure that they always have human company. Although in some cases it can be so specific that that it's the separation from that one particular caregiver that causes the problems. So for some dogs, as long as they're with any warm body, so by that I mean as long as they're with any person or people, they're okay. But for other patients, it can be that one specific person. And then, of course, that becomes tricky because that poor one specific person is very, very restricted then in what they can do. So Yeah, it can be extremely debilitating living with separation anxiety or separation related behaviors, and it can be costly, right? Like having to replace doors and windows. It can also be a real safety issue to the dog themselves, and we have to make sure that we really protect them from self-harm and self-injury in those moments. So they can be really quite complex behavioral issues to deal with, I would say. Okay. One other thing I wanted to quickly talk about just before we move on to, what's our approach, what do we do, is so we can talk about virtual separation and absolute separation. So some dogs will go as far as showing signs of separation anxiety when the caregiver just goes into a different room. So let's say they want to go to the bathroom to take a shower. That dog might sit outside the bathroom door and whine and cry and show these behaviors of separation distress. So it can be as severe as just the person moving to a different room and perhaps closing a door, and they don't have visual or physical access to that person. So we call those virtual separations. And then obviously the actual separations are where the caregiver then leaves the home and closes the front door and leaves the home. So yeah, quite a lot to think about. And again, when we think about the severity of these cases, we want to take into account all of these different pieces of the puzzle to try and understand what we need to do in terms of our treatment approach. Okay, so talking about treatment, we go back to our, classic approach of behavior modification, environmental management, safety management, medications, monitoring. It's kind of, we go back to our basics of what do we do in any behavior case, in any behavior presentation, what are the things that we need to look out for. However, separation anxiety perhaps is a little bit different, because the first thing that we always recommend, or that I always recommend, is that we want to, as we're starting treatment, because it can take a little bit of time to kind of, get a treatment protocol up and running. And the first thing that we want to do is we want to try and completely stop or eliminate any separation events at all. So for a period of time, that means no home alone episodes for the dog, and, making sure that they're always with somebody so that they can't continue to practice these behaviors to get, kind of represented with this emotional distress. We need to avoid emotional distress because it's going to be really difficult for the brain and the neurochemistry in the brain to recover from that if they're continuously being left home alone, right? So, and that can be tricky. And sometimes we come up against a little bit of resistance or barriers here when caregivers realize that they're going to have to sort of really try and make arrangements for the dog to not be on their own at any point, day or night. But there are a number of things that can be done if it's appropriate to do so. And if the dog is okay with that, daycare might be an option. Dog sitters might be an option. Recruiting friends and family might be an option. Taking the dog with them, to certain places. Could they come along to work? Could they come along to the shops or the restaurant or the coffee shop? So all those things need to be thought about to see whether there can be strategies put into place that the dog is no longer left alone, so that they can't go into this panic, that we protect them both physically and mentally and emotionally, and that we start to actually make a little bit of headway on settling down this neurobiochemistry, which is involved with fear, anxiety, stress, distress, panic, conflict behaviors, and so on. So that's the first thing. That's the first thing to any treatment plan. And that's sometimes the hardest hurdle for many caregivers to get over, is to try and, put some sort of strategies into place that can happen. The second thing is environmental management. So how can we start to manage the environment that we actually provide an appropriate environment? And again, that's looking at things like, do we have safe places? But if that safe place is a crate, does the dog suffer from confinement related distress? Do they actually enjoy being in the crate? Is it really a safe place for them? What else can we do in terms of environmental management? Can we drown out noises that might be triggering additional anxious events? Can we use other modalities, whether that's visual blocking or auditory blocking, to help set up the environment for success? So environmental management is always a big one. Now, the third one is behavior modification, and I'm not going to go into this in a lot of detail here and now, because that is literally a whole episode in of itself. All I'm going to say is that for many, many years, we have used very sort of classic desensitization and counter conditioning approaches, and they tend to be very, very difficult to implement, and they tend to be really quite difficult for caregivers to follow through on. It's really difficult not to go over threshold. It's really difficult to desensitize to all of those pre-departure cues that dogs become so good at picking up on, whether that's putting on the shoes or picking up the keys or taking the handbag or putting on the coat, or even as early as applying makeup and putting on perfume in the morning. A lot of dogs start to associate what came before the departure event, and they start to get anxious already at that point in time. And desensitization and counter conditioning, you'll hear a lot of these desensitization protocols can be really, really difficult to do. And I personally haven't seen a lot of success with that approach. So instead, we actually want to use independence training, we want to use predictability training, and we want to use positive reinforcement methods. So reinforcing the dog positively for being on their own and being independent. We want to use more of those approaches, managing global anxiety and fear, all that sort of thing. And that, like I say, it's an episode in of itself. And I think Ilse and I might do an episode together on that, because there are a number of things that might be really, really useful, and, that could be really great to use, and that might be a lot quicker to work and a lot more effective from a learning theory point of view. So I'm going to park that topic for here and now. And I'm going to move on to medications, pheromones, supplements, diets, all that kind of thing. And this is going to depend very much on the severity and the intensity of the behaviors that I spoke about. So, in very mild cases, we might be able to use maybe pheromones, supplements, and that together with environmental management, that might be enough to help the dog in that situation. But when we're looking at sort of these really severe distress behaviors, then we really need to consider psychopharmaceutical medications. And usually in these cases, we need a baseline medication that can actually start to address kind of that global fear. And we do have some medications that are actually licensed for dogs for separation anxiety for veterinary use. So we've got two. One is Clomicalm, the other one is Reconcile. So that's clomipramine is Clomicalm, which is a tricyclic antidepressant, and Reconcile is fluoxetine, which is an SSRI, selective serotonin reuptake inhibitor. And both of those medications are actually licensed for that use of separation anxiety, which is amazing, because we don't have a lot of medications that are licensed for specific indications like that. So usually we'll be looking at one of those medications as a baseline medication, but then we're also going to be considering event medications, departure medications, medications that we can give prior to the owner leaving the home, so that we can start to actually teach the dog that they don't that the dog then doesn't feel distressed and anxious in those situations, and we start to kind of shift the emotional motivation and the emotional state of that animal. Now, I have to be totally honest, finding the right combination of medications, especially departure medications, can sometimes be, quite a trial and error sort of scenario. I'd say we probably have about 4 different classes of short-acting event medications that we can use as departure medications, and finding which one suits the patient, suits the client, is active for long enough to kind of bridge that length of time that they're left home alone, because some of these medications are a little bit shorter acting. Some of them, only act for maybe 4 hours. Others will act for 6 to 8 hours. So it depends on how long the caregiver is planning to be away from home. And then we need to see what works for that individual. We need to maybe combine a couple of those event medications together. And that can sometimes take a little bit of working through, a little bit of trial and error. We might send a client home with 2 or 3 different event medications and ask them to do some trials with those. Now, that does not mean a trial where the dog's left alone, but that's just a trial, maybe at a weekend when everyone's at home, giving the dog those medications and then noting down the response. How long does it take to see any effect? Do we see any effect? How good is the effect? When's the peak of the effect? How quickly does the medication wear off again? Because all those things are going to then inform us whether that's going to be an appropriate medication for a departure event. So that's really, really important, I would say. And you really need to be working with a skilled vet that has a special interest in behavior, or with a veterinary behaviorist that's going to help navigate you through that. That's the medication piece. And then, of course, we mustn't forget our final M, which is our monitoring piece. So always, monitoring to see, are we having deterioration in signs? Are we having improvement in signs? And another point here that's really, really important is that we need to make sure that we're also addressing any underlying physical medical conditions, because oftentimes, physical health can impact the severity of separation-related behaviors. So we often see either a deterioration or even an emergence of separation-related behaviors in dogs that are getting older and that are starting to show signs of cognitive decline or cognitive dysfunction. So that's something that I would be thinking about in older patients. Certainly pain is always a comorbid presentation, not comorbid, can always be a presentation that can negatively impact any type of anxiety. And any other physical disease. So let's say, for example, we've got a dog that's maybe suffering from PUPD. That means for whatever reason, they're drinking more and they're urinating more. Now, that could be due to endocrine diseases. That could be due to kidney disease. So all of a sudden, we've got this increased thirst and we've got this increased need to urinate. And then let's say that, they're left home alone and they can't, access their normal elimination spots. That might increase anxiety. So we absolutely have to consider physical medical health here, as well as in all behavior cases, in all behavior presentations. So you can see it's a pretty complex presentation to work through. And it takes a really sort of multifaceted approach. You need to get the right information. You need to understand what the motivation is. You need to understand the severity of the signs. You need to understand, when they start to present. Is it the moment that, the owner or the caregiver starts to put on their makeup in the morning, that the dog is already anticipating being left alone and is already starting to kind of feel anxious, and that emotional state is starting to develop. And then obviously working through treatment can be tricky. That big hurdle of no separation at all, as we start to kind of work through some of these other modalities, choosing the right kind of behavior modification or training approaches that are going to work quickly and that are going to work well for the patient, and then choosing the right kind of medication regime to support this. All those things are really, really important. So I think you can see that separation is quite a complex topic. I've tried to give you a bit of a whistle-stop tour through it all. However, we're going to delve deeper into some of these kind of specific pieces of the puzzle. I definitely want to do an episode where we talk more about the behavior modification or the training elements, the learning elements that can be helpful. And I also would like to talk a little bit more about medications that can be useful for any vets that might be out there listening. So yeah, there's still quite a lot to go through, but yeah, that was my whistle-stop tour of separation-related behaviours. So I really hope you found this useful. I'd love to hear your comments or to read your comments in the chat. Please let me know if you've got any questions. And yeah, if you have, if you're a caregiver and you're living with a dog with separation-related behaviours, just know that it's really a tricky situation, and it can be really frustrating and debilitating for many different reasons. Number one, seeing your dog in that level of distress can be really not nice at all, and also the restrictions that it places on your life. And the knock-on effects from destruction and self-injury that the dog might be causing to themselves. I just want to say that we're here to support. We feel you. I totally understand that this is a difficult situation to live with potentially. And then just a final word on separation-related behaviours in other species. So there is a paper on separation anxiety in cats. And I actually do believe I've seen the odd case of separation anxiety in cats. They're a lot less common than dogs, and something that you really again need to tease out, in a really sort of comprehensive behavior consultation and watching videos. And then, of course, horses can also show separation-related behaviours, but that's usually separation from friends, separation from the herd. If they're being taken away from the herd, that's when those behaviours can usually show themselves. So, we've spent a lot of time talking about dogs, but do know that other species can experience similar presentations. And again, that might be a really good opportunity for a future episode. All right, I'm going to love you and leave you here, and I'm looking forward to seeing you next week for episode 34. Bye for now.